Hello, hello. My name is JC, and I'm a clinical exercise physiologist, cancer exercise specialist, and online coach here at Oncology. Now, Oncology is one-on-one coaching for cancer survivors. It's a space where I do your exercise programming, nutrition. We go over lifestyle, mental well-being, all during and after treatment to make sure that you never have to guess during your cancer journey. Now, in today's episode, I'm really excited because it is my first episode. We are going to cover how to exercise when you're too scared to hurt yourself. Now, we're going to go over different myths surrounding different fears that I get to hear a lot of the time, either online or from my coaching clients. We're going to talk about how to get started breaking away from a lot of those fears. And we're going to talk about what movements not to do so that way you will be safe for the most part, right? And we're going to talk about a routine I do for my online coaching clients. The reason I say for the most part is because if you follow the routines that I'm about to give you, if you follow the guidelines of what not to do, you're going to basically stay away from most common injuries. Now, there's some very specifics depending on the cancer type you need to be aware of, but I'm going to try to cover as much as I can in this podcast to make sure that you can exercise safely and get rid of some of those fears. Okay. So, before I dive deep into the strategies of exercise and cancer and what to do and what not to do, I want you to know that your fear is valid. Okay. There's no shame because of your fears, your worries, your caution. They are normal to have. And it's also makes sense. It's warranted. You've gone through a lot of trauma and you continue to go through a lot of trauma in your body with treatment. So you do want to be careful. I have heard horror stories of cancer survivors maybe going into the gym, either exercising by themselves or just with a trainer who had no idea how to work with cancer survivors and they break a clavicle. They do something that makes things worse, an injury. So it's very important that you do work with somebody who knows what they're doing and that you get as much guidance as you can because it's really hard to get good quality guidance these days, other than just, exercise. So it's very common to have fears. Do not feel guilt, or maybe better said, when you feel guilt or shame, something to think about is that this is something new for you and for your body. So it's normal to have those cautions, and it's okay. All right. When something is new, you can either fumble through it, or you can be guided by someone who has either been there or knows what you're going through to get you through it. And that's what I'm here for. Okay. So now, when it comes to worry or fears, you want to make sure you know what it is that you're scared of. And we're going to go over all of these. But many times I hear I'm scared that I'm going to break the port or I'm going to hurt an area where they had surgery in. So, for example, if it's breast cancer, a lot of breast cancer survivors are scared that they're going to hurt the area that the chest or the shoulders, where a lot of the incisions were made, or abdominal surgeries, same thing. So, fear of the surgical site getting injured is very common. Fear of the port or the line being damaged or moving within their body is also very common, and also fear that the cancer is going to spread or that exercise is going to cause the cancer spread. All right, so let's kind of dive deep into each one of those. Let's start with the biggest myth, which is fear that exercise spreads cancer. Now, this is the furthest thing from the truth. Okay, exercise actually has the opposite effect, and it literally reduces risk of reoccurrence. It helps reduce risk of cancer, so cancer prevention. It helps reduce risk of metastasis. It helps target cancer better. It weakens cancer cells from the inside out. It helps your immune system target cancer cells better. So the idea or the worry that exercise is going to spread cancer is a long-term myth that has been proven to be false. Okay. So you can exercise safely, freely, without any worry. And in fact, that's encouraging because now you can exercise knowing that you have some sort of control in your treatment. Because when you exercise, you are in control of that cancer fighting effect, right? A lot of treatment is things being done to you, or when you exercise, you get to make that decision. So, exercise is good, safe, and feasible during and after treatment. Now, the second worry here is that it's going to damage the pore or the PICC line. So, first thing to know with that is that there is no studies, there's no research that shows that that is true. But it is a good worry to have. Okay. Now, that does not mean go ahead and put 500 pounds on your chest and start benching like you did before. Okay. But it does mean that you can use the muscle group where the port is or the line is. So, what I like to do is there's two approaches you can do, and it's going to depend on which one you feel more comfortable. Flat out, the answer is it is safe to exercise with a port. It's not going to break and it's not going to move on you. But that being said, there's two approaches that you can have if you are scared. The one that I recommend is the one that's best for your well being. So I'm going to give you two examples. One is an online coaching client who is very scared that she's going to damage her port. Now, this online coaching client has talked to the surgeon, has talked to the nurses, has talked to the oncologist, and they all said, and has talked to me, and we've all said the same thing. You can exercise without any fear, nothing's going to happen to the port. Many of these new ports are actually designed to last and stay in your body. It's not going to move. The only way it could move is if you just build so much muscle that it moved the port. But in reality, you're not going to be focused on that much bodybuilding in that specific area. Okay. And it's very hard to build muscle, by the way, especially during cancer treatment. So that's not a plausible or a probable thing that's going to happen that's going to move the port. Now, if you're still worried, even though you've gotten a bunch of different advice saying, hey, this is not a probable thing to worry about, then you can just exercise muscle groups around the port. And that's still healthy and good to do. If you hear that advice and you're like, okay, I still want to do, let's assume that the port is on the chest, then you can do your chest flies, your bench press, your flies, whatever chest exercise you want to do, even though the port's on the chest, but you're not going to max out the exercise. And instead of, going as heavy as you can, maybe you focus on range of motion first. The biggest thing with the port is just making sure that the wounds have healed before you start exercising. That's it. After that, you are free to exercise. Once again, the approach I take with my online coaching clients depends on their mental well-being. If there's somebody who's a little bit more worried, even though we've all said, it's a green light, then I'll just program exercises around them. I'll still let this person know, hey, we still need to do some chest exercises, but we'll just keep them light and focus on range of motion more than anything. Both approaches are fine and healthy to do, but in general, you can still exercise with the port or align in. But what about an ostomy bag? Same exact thing. There are some guidelines to be aware of when it comes to an ostomy bag, and I'll put the descriptions and the details on that below because there's a lot more guidelines to them. But you can also exercise with an ostomy bag on. The little things that I recommend is empty it out before you exercise. And do seated and isolated exercises is absolutely fine. Make sure you're not bending over with it, things like that. But you can exercise with it, and it's extremely safe to do so and healthy. And then the last common fear is that exercising after surgery is going to hurt yourself. Or another one is that you can't lift more than 10 pounds after surgery. And that one really irks me, not because people believe it, but because it shows me how poorly the information after surgery is. And what I mean by that is that the guidelines after surgery to not lift more than 5 to 10 pounds only matter when the wound is healing. So listen to me, people. It only matters when it is healing. What that means is your surgeon is going to give you a time frame. No exercise for 6 to 8 weeks, no exercise in 2 weeks, whatever it is. In that time period, you can still exercise. Walking is a form of exercise. You're just not going to do direct work to that site. And that's when you can't do the 5 to 10 pounds. After the surgeon gives you the clear and he says, yep, you're free to go ahead and get back to your day to day, just progress as your body allows, that means you can lift more than 5 to 10 pounds. That restriction has been taken away. This is also very common with lymphedema. I hear breast cancer survivors all the time. Well, my surgeon said, or my physical therapist said that I can't lift more than 10 pounds. That is no longer true. That has been proven to be false in the exercise oncology research. A lot of times, this doesn't get to, let's call it the hospital or the providers, because providers see patients. Many of them are not up to date with the research, and it's not their fault. Some of them, try to be as much up to date as they can be. Others, they're just so focused on patients that they really can't. Regardless, it is extremely healthy to lift weights after lymph node removal once you're cleared, after big surgery once you're cleared, and you can lift more than 5 to 10 pounds. You're not going to hurt that area. In fact, it is more damaging to not do any movement or exercise in the surgical site than it is to do movement. I've seen many cancer survivors have frozen shoulders, stiff necks, aches, pains, limited range of motion for babying the area too much. Very common, but that causes more damage in the long run. So you want to make sure that you are doing some exercise and some movement for it. Very healthy and good to do so. Okay. If there is a fear that you have and I did not cover it, go ahead and leave that in the comments below and I'll make sure to answer it in another episode. Or if you want me to dive deeper into another fear or myth or question that you have, once again, go ahead, leave it in the comments below and I'll make sure to give you a longer, in depth answer on it. Because that's what I'm here for. I'm here to help and answer as much as I can for you. Now, the next thing is how to break away from the fear of exercise. It's kind of like a spectrum, right? And depending on who I'm working with, I'm going to start in a different place. But in general, for most people, I want you to know that walking is exercise, okay? Walking does count as cardio and it's going to be safe 99.99999% of the time. Okay. If you don't know me, once again, like I said, my name is JC, but I've literally worked on cancer studies where I've worked with oncologists and breast surgeons and GYN surgeons, where the patient just finished cancer surgery, for example, a hysterectomy, and the surgical oncologist spoke to me and spoke to the team and said, we want these patients to walk because that's going to be the best thing to help prevent blood clots in the future. Okay. So even after a big surgery like a hysterectomy, walking is still really good and safe to do. Now, I'm not going to say go ahead and put an incline up, walk a mountain, go up and down hills, but just walking at a leisurely pace, especially after surgery, is going to be very important and a foundation in your exercise. Okay. That's your daily bread, per se, walking. Now, once I see that somebody has a good pace, feels comfortable with walking, has a consistent walking routine, that's when I'm going to start pushing them a little bit more. And it's going to start with stretching or mobility. I love using stretching or mobility as a way to incorporate exercise in somebody's life because it's one of those things that you get immediate benefit. You're not going to be sore the next day. You're going to feel better. You get immediate gratification. And you're like, wow, this whole exercise thing really works. So I like to start with stretching or mobility. If you are scared to start with exercise, that's the best place to start. Now, let's say you just had surgery. And I mean, like you're fresh out of surgery 1 or 2 days, and you're still within that time period where your oncologist has not cleared you for exercise. This is where I'm going to recommend working with a physical therapist. Now, if you have trouble finding a physical therapist, I do have a referral for a physical therapist that's really good. I'm not a physical therapist, by the way. You work with me after or during you or while you're working with the physical therapist. But physical therapy is what you're going to use in that time frame before you get cleared for exercise. Once you're cleared to exercise, then hello, that's where I come in. But stretching is going to be a great thing to help bring some satisfaction, immediate gratification, reduce a lot of aches, stiffness. You do not have to stretch the area of the incision. This is why I say work with a physical therapist. But You can still stretch your legs, your lower back, your arms, your chest. Depends on the area that you had the surgery in. You can still stretch other parts of your body to help you feel good and better. That immediate gratification is going to help you stay consistent with some movements. Now, I talked about stretching and mobility. I would put mobility after you've been consistently stretching because mobility is forcing a range of motion in a stretch position or putting pressure on a joint when it's stretched. So it's a little bit more uncomfortable than stretching itself. So I would focus on mobility afterward. Or if you're somebody who's been very active, already flexible, then mobility would be your next maybe step into getting some more movement in. Now, focusing on those three things is going to help build some confidence, help you get some consistency on the belt, help you feel some motivation, and help you get some satisfaction from what you're doing. It's just a starting step. It's just like taking a little sip to make sure that you like it, dipping your toe in the water, right? And being like, oh, okay, this feels kind of nice. I could get jiggy with this, right? And that's really what these exercises are. It's an introduction. It's not going to build muscle. It's not going to give you outrageous amounts of strength. All it is just to help your mental well being and get you started with something. It's to build the exercise muscles, per se, or the mental exercise muscle of getting into the habit of doing something physical despite how you feel. And the good thing about it is that even if you have cancer fatigue, a lot of this doesn't require much energy. You can do this in bed, on the couch, on the floor, and you're still going to get the benefit of it. Okay. So that's extremely, extremely important. All these little movements are going to add up throughout your day, throughout your week, and eventually you're going to get to a point where you feel better. Now, what are exercises you should not do, or what are things you should avoid? Okay. This is going to be very general, but it's going to give you a good starting point. Because it is going to be different depending on cancer type, where it is, what the side effects that you're feeling, surgeries, all the above. But if you feel a sharp pain, that is something that you should avoid. Okay. If you are exercising and you have metastasis somewhere, let's say you have liver metastasis, bone metastasis, you want to avoid putting pressure on the areas with metastasis. So, no running, jumping, or anything like that before wounds are healed or if there is metastasis. Obviously, I don't want to say this is obvious because I do get this question, but avoiding contact sports. Your body's not really ready to handle that contact, that physical contact right after cancer surgery. Your body has to be pretty well fit beforehand to really start getting to that. Um, so it's not the time to be starting it. If you were fit and active before, you're doing contact sports before, then you might be able to, depending on the person. But generally speaking, contact sports is something you would want to avoid. Now, hit training is a common question I get asked. I mean, the internet and social media is full of, oh, hit this, hit that. That's funny. But hit high intensity interval training should be avoided if you have any uncontrolled heart rate or blood pressure. If you have menopause, it should also be avoided. And if you have low platelets or low white blood cells or red blood cells, you also want to avoid HIT and you want to avoid adding too much weight or heavy weight. Those are cases where you do want to stick to using resistance bands only. And then in that case, that would be safe to do as a way of resistance training. Now, what I do for my online coaching clients to set a foundation, to help them feel better, to help them exercise and help them overcome all those challenges is everything I just said, but the order I do it in is specifically designed for what they're struggling with. So I am going to randomly choose, a breast cancer survivor. Okay. If you are a breast cancer survivor and you are struggling in general, depending on what you're feeling, I would be focusing on making sure you're getting your daily steps. I'm looking for, depending on your age, depending on how much treatment you've gone through and your mobility, I'm looking for anywhere between 4,000 and 6,000 steps. If you are consistently getting more than 6,000 steps, Then I will add in cardio. Okay. But before then, I'm really just looking for you to move. Go to the grocery store, walk around the house, take your kids out to the park, walk your dog on extra time. Just any type of movement that's going to help you get your steps up. Because cardio is good, getting enough steps is also good, but they have two different purposes. You can get steps at any time throughout the day. You can't always go for a walk specifically designed to push yourself throughout the day because you might have to work, you might have kids, you might be tired, might be nauseous, whatever it might be preventing you that day. I just want you to focus on getting steps. And you're probably thinking, 4 to 6,000 steps, that's, way too low. Or, the internet doesn't tell me that. They want me to get 10,000 steps. 10,000 steps is just a very fun, marketable number that was used in I think it was Japan to get people to move more. And 10,000 steps is phenomenal, but it's also not realistic for many people. Now, I do work with somebody who gets 12,000 steps a day, but it's very rare that somebody gets 12,000 steps in a day. Generally, 4,000 if it's somebody who's really, really struggling, and 6,000 is very, very doable. Now, the sweet spot of like a perfect, let's say, day of steps is 8,000 steps. That's like perfect. But if you're normally getting 4 to 6,000 steps within your day, and I add in a 20, 30-minute walk, you're going to reach that. So you're automatically going to get your steps by getting in that cardio workout routine. So that's why I want that foundation first. Now, from there, once I see that that routine is already built, they're constantly getting their steps and they're constantly building their cardio, this is where I start to include corrective posture exercises. I said earlier, it's for a breast cancer survivor. So breast cancer survivors tend to be hunched over all day. And this is for anybody, by the way. So this is going to apply for anybody. I just use breast cancer arbitrarily here. So, after chest surgery, even in head and neck cancers, that you tend to be hunched over more, you tend to be protecting the arm more, you tend to not use it as much. So focusing on straightening out your back, doing shoulder rolls, moving your neck, doing some shoulder stretches behind the back, bringing the arm across the chest are great stretches to do. But I'm specifically focusing on upper traps, rhomboids, aka just the muscles around your shoulder blades, upper back exercises to help strengthen the posture throughout the day and open up the chest. Okay, so that's one way that I start including some exercise, a mini workout plan to help bring some confidence in your body, help you feel immediate gratification, and it's going to last throughout the day because the stronger those posture muscles are, the less hunched over you're going to be, the more confident you're going to feel, which is something extremely important after cancer. And the easier it's going to be for me to help introduce other exercises along the way. Now, once I can see, and from talking to you, from seeing how you move, I can see and feel that, your mental well being is better, you're sharper, you enjoy what you're doing. Then we start incorporating a nice little warm up routine to get you into your actual workout. Okay. And then once you're ready for your actual workout, that's when I start peppering in those posture exercises. But if you're struggling with fatigue or you're not struggling with fatigue, I still give everyone two things: a fatigue plan and a warm up. Now, if you follow me on social media, you've probably heard me talk about a 10-minute rule. Now, the 10-minute rule is when you take 10 minutes to either do a 5-minute walk out, 5-minute walk back to see how your body's feeling. This is perfect for in treatment, by the way. If you're in treatment, this is a game changer. Those 10 minutes, all you gotta do is commit your mind to 10 minutes or even 5 minutes. It doesn't really matter, right? X amount of minutes, 5 to 10 minutes. And after those 5 to 10 minutes, if you are feeling better, then you continue and readdress how you feel 5 to 10 minutes after that. If you don't feel better, then you stop and then you try again later. There is nothing wrong with trying again later. You're not a failure. You did not mess up. That is okay. Sometimes the sickness just really kicks in, especially if you're later on in your treatment or if the treatment really kicked your butt that week. So it's okay to try it and then just say, nah, man, this is not for me today. That's okay. There's nothing wrong with that. That's why we also have the fatigue plan. Now, in the fatigue plan, it's a plan specifically for days where you're low on motivation or struggling with fatigue. These are exercises that you can do in bed, laying on the ground, or stretches that you can do in bed, laying on the ground that require very little energy, but just make you feel better. So, once let's say you did your 10 minutes and you feel better, that's when you actually go into your workout. So, the 10 minutes is to loosen up the joints, bring blood flow and circulation to your body, and see how your body's mentally and physically doing to continue with an actual workout. Many cancer survivors, the biggest mistakes they do is they just go to the gym and they just pretend like the workout's going to happen without preparing the mind, the body, your spirit for the workout. So that's extremely important to do. Once you've done that, then you can get into it. And you're going to be surprised because you think like, "Oh, I already don't have energy for my workout. Like, how am I going to do a warm up with it too?" You will be very surprised that by doing a warm up, it's actually going to give you more energy for your workout. And even if, let's say, you don't feel that great after your warm up, hey, that's okay to be done. Nothing wrong with that. No shame and no failure. Now, once you get into your routine, that's when you're going to get into, your full body, or depending on who I'm working with, upper, lower, pull, whatever the routine is according to their schedule. Generally, I like to keep workouts between 20 to 30 minutes because I know people are busy. You get to work out whenever you want, because let's be honest, I mean, the last thing you really want to do is just meet with somebody for an appointment to do exercise with, right? So the routine is set so you can do it whenever you need to. If you have a doctor's appointment, you got to pick up the kids, you don't have to worry about anything. You just get it done whenever you can. And it only takes about 20 to 30 minutes. If somebody feels good and they love working out, I'll push it to 45 to 60 minutes. But for most people who don't really like exercising, don't have the motivation, 20 to 30 minutes is more than enough 3 times a week. And what's cool about that is that there's research to show that for breast cancer survivors, you can build some strength and maintain some muscle mass even with just 1 or 2 days a week. So don't feel like a failure if you're not getting those, 5 or 6 days, whatever you thought was the gold standard, right? Just 1 to 2 days minimum if you're super busy, or you're struggling a lot with fatigue. But 2 to 3 is a really good sweet spot for most people when they're starting out. Okay. This is going to help build a foundation, a routine, confidence in your body, confidence in your skill, and it's going to start making you feel like you're in control again. It's going to give you some posture, reduce your risk of hernia, reduce your risk of injury, and it's going to help get rid of a lot of the fears that can come to mind while you're exercise, or even before you start exercising. So the biggest hurdle is always, not knowing what to do. And I kind of broke some of that down. But if you don't know what exercises to do that are maybe some good stretches or some good posture exercises to do, I'll put my YouTube channel below. And in my YouTube channel, I have a bunch of different stretches that you can try. You want to stretch the back of your legs? You can just put there's a little search bar on my YouTube channel, and you can just put, back of the leg or hamstrings or lower back, and you're going to get a bunch of different stretches. And I'm going to talk about how to actually do them so that way you feel it where you need to feel it and get the results you want. Okay. I'll also have, different safety tips on there. That's a great resource that you can use to make sure that you're getting, the benefits that you're looking for. Now, like I said earlier, if you have any questions or if there's anything that I said that you're not sure of, go ahead, put it in the comments below, and I'll make sure to get those answers for you. My goal is to help you, move forward whenever you're struggling, give you a clear direction of how to build confidence and strength in your health after cancer. Once again, I'm JC. I'm really excited to help you along this journey, and I wish you the best. Take care.